In order for children and families to get the care that they need, there needs to be really good collaboration across the system and different professions. We realized, and when I say Dr. Marson and myself, we realized that if we weren't working with other organizations, then these kids would not get access to care.
NvCAN is currently working with many students and many licensed professionals who are not very confident in diagnosing autism. So we would like to continue training and building those programs. We're also helping mentor other established programs in developing their own multidisciplinary teams to help assess the needs in our community so our families are not on wait lists as long as they are. Additionally would be to provide continuing education. And we do offer supports from our team members to our team members, and some of the challenges that we face are families with significant traumatic histories. So our team is very supportive of each other and providing that counseling and education.
We are using AI to manage the data that we have been collecting at UCAN for the past 20 years. And because it's clinical data, we need machine learning and AI to help organize the data. So in terms of the collaboration, we are looking at a two-step process where step one is going to be using AI to organize the data, and the second step is going to be using AI to identify different patterns to see if we can find distinct behaviors or distinct profiles in individuals of autism that are unique or different from those who do not have autism. So that work is still in its infancy. We just started the collaboration, and we are also writing a grant which we are hoping will get to support this work.
I really love working with UCAN because it's an interdisciplinary assessment team, meaning I'm not the person trying to make the diagnosis by myself. I've got a whole team of experts who have expertise in different areas. It's just really advantageous to have all the experts in the room together, and instead of being siloed in each of our disciplines, we're able to sort of cross over, really discuss, could this be ADHD plus a language disorder, or is this autism? And so that way you get a more accurate diagnosis, which is really going to inform how the family and educators and practitioners are going to approach that child potentially for the rest of their lives. So it's a very meaningful and important diagnosis.
We ended up bringing people in from the school district. We started making contact with pediatricians. We started making contact with other organizations across the university, working with some state agencies and working with these professionals. What we were looking at is a system of care. If they don't have a system of care, then they're not going to get the interventions that they actually need.
So up here in northern Nevada, we have some limited resources, so it's really important for us to collaborate with our partners, to use resources wisely, help parents navigate the system to quickly get what they need and not having to go through a lot of bureaucracy. We are really passionate about is training up the workforce and bringing people here to the UCAN team or going out to where they're at, bringing trained people that we can work with local providers in schools, clinicians, pediatricians, to help give them the skills for diagnosing autism and other related neurodevelopmental conditions.